Assalamu alaikum and welcome to Health is Wealth. Today we will be raising awareness on infections and antibiotics. Infections can be viral, bacterial or fungal. But it's important to note, however, that infections that are of a bacterial nature are usually treated by antibiotics. Antibiotic resistance is on the rise at an alarmingly high rate. So it's very important that you take your antibiotics as prescribed, on the right dose, the right time and the right duration. Please take your antibiotics as prescribed by your doctor and as advised by your pharmacist. Today in the studio we have Somayya Hussain, who is an antibiotic pharmacist at the Princess Royal King's College Hospital NHS Trust. Welcome to the show, Somayya. Thank you for joining us today.
Thank you.
So Somayya, can you tell us a bit about your role as an antibiotic pharmacist?
So as an antibiotic pharmacist working within a hospital for the NHS, my role involves advising doctors and pharmacists on when to prescribe antibiotics and when not to prescribe them. And if an antibiotic is necessary for treating an infection, then the best antibiotic for that infection. A part of my role is also to assess whether the antibiotic prescribing is appropriate.
Oh, okay, that's very interesting. So can you tell us, as an antibiotic pharmacist, how can we sort of help prevent infections from spreading from one person to another?
Well, I know it's a really cliched thing to say, but hand washing. So washing your hands frequently would prevent infections from spreading.
So it's true then, because we see it everywhere, you know, signs everywhere, please wash your hands. Yes, so is that really, is there evidence to show that this actually reduces the spread of infection?
Yes, I mean, bacteria tends to travel via several different media, but the biggest way that it can travel is by contact. So if anything that you come across in contact with and then you touch something else, you're actually contaminating that surface. So make sure that you wash your hands frequently. If you are the person who's got an infection, or if you're caring for somebody who has an infection, i.e. an elderly relative, or you might have a small child that you look after, please make sure that every time you come into contact with them, you wash your hands with soap and water. Similarly, if you have the type of infection that causes you to cough or sneeze a lot, then make sure that you use a tissue and you discard that tissue after each use.
So this huge government initiative that we've had, you know, signs everywhere, catch it, bin it, kill it.
Absolutely, yes. I mean, that would be a good way to ensure that it's not spreading via droplets that you might be sending out there. So it's a good idea to make sure that you catch it, bin it, kill it.
Okay, that's brilliant. So they're quite easy steps. So your take-home message here really is wash your hands, and if you have any sort of, you know, coughs and colds and you're using a tissue, to discard the tissue once you've used it.
Yes.
So is soapy water, you know, does that do the trick, or do we have to sort of invest in all these antibacterial wipes and swabs and what have you?
It wouldn't harm to invest in these antibacterial wipes. I mean, personal hygiene, observing good hygiene around the house and for yourself as well, is very important to prevent the spread of infection. I should also mention that if you do have an infection, it's probably best to stay at home, because when you go out there to work or to university or school, wherever, you're actually risking passing that infection on to somebody else. So you risk making other people sick as well.
So maybe the most common infections we see in the community are things like gastroenteritis, tonsillitis, chest infection and urine infections. So can you give us some sort of insight as to what kind of things we should be looking out for when we suffer with these infections?
So all the infections that you've mentioned just there could either be bacterial or viral, with the exception of a urine infection, which generally tends to be bacterial. For viral infections, they generally are self-limiting, so that means they'll clear by themselves. However, you know your health best. So if you feel very unwell, then go and see your doctor. The other thing I would mention about chest infections is that you would see symptoms such as a persistent cough or producing yellow and green phlegm and a raised temperature. If you have those symptoms, and also if you have any recent history of foreign travel, please go and see your doctor, because they might need to investigate it further to see if it could potentially be TB.
Right.
With sore throats, tonsillitis, you would notice a sore, painful, swollen throat, and you would also notice difficulty swallowing, so it would be a little bit painful when you swallow, and you might again have a raised temperature. It's important to go and see your doctor then. It could be viral, it could be bacterial, but if you feel disorientated or if you feel very, very unwell, then please go and see your doctor.
But nowadays, a lot of pharmacists as well, they can actually assess your level of tonsillitis as well, can't they?
If it's bacterial in origin, then some pharmacies are able to do a strep throat test.
Yeah.
So they can check to see if it's actually streptococcus, which is a bacteria, and then the appropriate antibiotic can be recommended. It's also important to mention that these days, with hay fever, you'll experience very similar symptoms. So it's important not to get confused, but with hay fever, of course, you wouldn't get a high temperature. If you have a high temperature, then you most definitely have an infection, along with these other symptoms.
Yeah, so in that case, your pharmacist can help you then, isn't it, when it comes to hay fever?
Yeah, urine infections, Ramadan obviously, we're not drinking as much as we usually would. So the stagnant urine that you have in your urinary tract would actually harbour bacteria, and they could multiply again, as I said, at an alarming rate. And when they do multiply, they can colonise that tract, and then they can produce symptoms like you might feel like you need to go to the toilet more often than usual. You might experience some foul smelling, dark urine, and you might even get some lower stomach pain. All these are signs that you probably have a urine infection. So it's good to see your GP and then get some antibiotics prescribed.
Oh, that's great. That's good to raise awareness of these common sort of symptoms that you can experience. So antibiotic resistance is a huge public health issue at the moment, and it's a huge concern as well worldwide. So what's your sort of take? What is antibiotic resistance?
Bacteria multiply very rapidly. So you could get some bacteria that can potentially produce 1 million copies per day or more than that. When they do multiply this rapidly, they also have the ability to modify their genes. What I mean by that is they can develop a mutation. When they develop these mutations, they will no longer be sensitive to the drug that they're being exposed to.
So what's a mutation?
A mutation is their ability to adapt themselves so that the drug that you're exposing them to will no longer be effective. When that happens, you can get that particular strain of bacteria multiplying, and then that particular resistant bacteria will be colonizing you. So the antibiotic you're exposing it to is no longer effective. That is a big problem, and that is where you get multi-drug resistant bacteria.
Gosh, that is a huge concern, huge concern. So what advice do you have based on this? How can we minimize antibiotic resistance?
As I mentioned, it's the exposure to the antibiotic that's causing this bacteria to become resistant, but you must take antibiotics if you actually have an infection. So it's important to finish the prescribed course, and it's important not to skip any doses. So as you mentioned, take your antibiotics as prescribed by your GP and also as advised by your pharmacist. So make sure that you stick to the correct duration and the correct frequency of tablets or capsules, whatever you may have been prescribed. Antibiotic resistance will become an issue the more you expose the bacteria to antibiotics. So taking different antibiotics, taking antibiotics that don't target specific bacteria, and also unnecessarily taking antibiotics when you don't need them. It's important to only take them if they've been prescribed for you. Do not share your antibiotics with your friends and family.
Well, it's interesting you say that, Somayya, because especially in the South Asian sort of subcontinent, where there's not so much control with drugs, where you can easily go and walk into a pharmacy and just pick up a whole batch of antibiotics, bring them back to you to your home country, and a lot of people are self-medicating and self-prescribing.
My advice would be that is dangerous and it's irresponsible. Not only are you potentiating antibiotic resistance, your medical history and your health picture is best known by your GP. They are in the best position to prescribe your antibiotics. Antibiotics are often broken down by the liver and cleared by the kidneys, so you don't know what your liver and kidneys are functioning at. Your medical professionals that you liaise with do. Similarly, your friends might not have the same health picture as you, so one antibiotic does not fit all. You might not have the same sort of infection that is treatable with that particular antibiotic. So always finish your course. You shouldn't have any antibiotics lying around the house. If you do, please safely dispose of them with your community pharmacist. So leave them there and then they will get rid of them for you. But never ever take antibiotics for the same, never take same antibiotics for different infections, and don't share your antibiotics.
That's very good advice. Thank you very much for coming to our show today, Somayya, and for joining us today. Thank you. Antibiotic resistance is on the rise. If you are prescribed antibiotics, it's important to note that you must take them as prescribed by your doctor and as advised by your pharmacist. Please do complete the course. That's the biggest take-home message that we've got today. If you are having an infection, it's important for you to stop the spread of infection, so please do wash your hands. If you have a cough or cold, catch it, bin it, kill it. We hope you enjoyed the show today. Now it's time for our fitness segment with our personal trainer. Assalamu alaikum.
Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'm going to show you how to use a stability ball to combat lower back pain and activate your core. Now this exercise that I'm going to show you, you can do at home while you're watching TV or at an office instead of a desk chair. So all you have to do is do exactly as I'm doing right now. Sit on the ball. Now it's very, very low impact, but it is very, very effective in terms of activating your core and strengthening your core. So the only things that you have to keep in mind here is choose a ball that forces you to keep your knees at a 90-degree angle or closest to a 90-degree angle as possible. You'll also want to keep your posture as straight as possible, so keep your shoulders back and keep a neutral spine. If you're using at a desk, make sure your desk is at the right height so you don't have to keep your hands up or your hands lowered down. I'd suggest you start doing this for 5 minutes a day and work your way upwards. If you're not used to it, it can feel a little bit tiring towards the end, but I suggest you keep with it and persevere through.